Insurance Service Providers Association of Ghana is calling on the Minister of Finance to immediately withdraw the additional 2.5% VAT imposed on all imported drugs and the 17.5% on locally manufactured drugs. The call is part of a communique issued by the Health Insurance Service Providers Association of Ghana after its first quarter review meeting. Now, the Health Insurance Service Providers Association of Ghana also called on the Minister of Health to immediately establish an adjudication committee without any further delay to mediate issues between the authority and service providers. My name is Stephen Enti, and this is today's big story. Well, let's do some analysis now. Salam Adonu is Communications Manager of the National Health Insurance Authority. He's joining us now on telephone. So, good evening and thanks for joining us on today's big story. Salam.
Thanks very much for having me, Stephen.
Now, let's shift this communique, which is a very copious document from the Association of Health Service Providers. We are trying to get the executive director and communications person for that association to speak to us first. But before we go to the substance of that communique, the Ghana Medical Association has said that the National Health Insurance Authority is plagued with a lot of challenges, including weak systems, poor monitoring and evaluation, poor institutional and professional accountability, among a host of other things. So, where do we stand today on the National Health Insurance Scheme? What is the status of the insurance scheme?
Well, that's an interesting one. I never heard that. I don't know where that statement was made. I don't know who made that statement and in what context. So if you could just elaborate a bit on who said it exactly and what the context was. I think that would do.
Well, I mean, the context was a presentation by the GMA president earlier this year, sometime around the time that Parliament called for the review and extension of the capitation pilot in Ashanti region. But the thrust of the matter was that the GMA was recognizing the fact that the National Health Insurance Authority faces a lot of challenges. I mean, there's a tall list of challenges the Medical Association is saying that the Health Insurance Authority is facing. I mean, that's not to say that that is the exact situation on the ground. You have to tell us. That's why I'm asking the status of the National Health Insurance Authority and the scheme today.
Well, thank you very much, Stephen, and good evening to your viewers. I think the National Health Insurance Authority, as the kind of institution it is and the key role it plays in our economic development as far as the health sector is concerned, I think we are doing well. Nobody has said that the National Health Insurance Scheme is without challenges. You know, we have our fair share of challenges, just like any institution would have, just like the GMA itself has. You know, so when you're dealing with a subscriber base of about 10 million people, there are a number of things you have to look out for. For example, you need a very strong, ICT infrastructure and a lot of things like that. Of course, you may have a lot of those things, but a lot of those things may feed into a bigger system, which has a national, backbone and all. And when something goes wrong somewhere, you can realize that there could be other repercussions elsewhere. But of course, I think we recognize that challenges exist, but we have also put in place a number of things to ensure that these challenges are addressed. And it's like the onion, because it's such a dynamic thing we do, such a dynamic organization facing a lot of dynamic issues. So it's like the onion. When you peel one layer, another layer which is totally different and totally unknown and new, pops up. So you keep solving, you keep moving ahead. And we have always said that the NHIS, with all that it's achieved in the past 10 years, has always been work in progress, and we are very much, modest about our achievements, and we are happy about the few things we've achieved. So for somebody to paint such an ominous picture of what Ghanaians collectively are trying to do for themselves in terms of purchasing healthcare and protecting the vulnerable from high cost of medical bills and healthcare. I think it may not be the exact story to tell. Of course, we've had our challenges, but I think a lot more is gone on. So I think it's just how he wants to see it. You can choose to focus on the positives, or you can choose to focus on the few negatives. But we choose to focus on the positive, whilst we are minded and we know that there are a number of things we also have to do.
Right, Salam, I'll have you hold. I'll return to you, so we will toss these challenges and put them in the right context and see the exact solutions or resolutions we have for these problems. But we're joined on the telephone line now by Anthony Ameka, who is Director of Operations and Communications for the Health Insurance Service Providers Association of Ghana. So, Anthony, your communique, a big document. I mean, it's a tall list you have here. You have made recommendations about 7 points of things that you want to address, you want to be addressed in order to make healthcare delivery efficient. Let's take it one by one. You made reference to the fact that the Clinical Audit Division of the National Health Insurance Authority was set up in 2009. We all know that is a fact. But based on that, you're saying that the National Health Insurance Authority should go ahead and conduct regular audits. Is this to suggest that your Health Service Providers Association has found out that there are no regular audits in the National Health Insurance Authority, for which the scheme is suffering?
Thank you very much. As you mentioned earlier on, we appreciate the fact that the Health Insurance Authority have instituted the clinical audit system. We had a stakeholder consultative meeting, and at the meeting it was noted that a lot of submissions or claims that we made to the National Health Insurance Authority need to be properly vetted, even at the facility level.
So before you continue, please tell us what precipitated this stakeholders conference or meeting.
Again?
I'm asking you, you just told us in your narrative that you held a stakeholders meeting or conference. I'm asking what exactly prompted that meeting for which you came out with the communique that we're dealing with today?
Yeah, we were looking at the role of service providers in promoting quality health care and how to be able to sustain the National Health Insurance Scheme.
And you just decided to hold that meeting based on nothing?
It was based on other meetings that we also attended. That was organized by National Health Insurance Authority. They invited us. And we also realized at that meeting that there were a lot of shortfalls, especially when it comes to healthcare delivery in the private sector. So we realized that there's a need to actually share some of the observations or the issues that were raised, and sometimes to some of the research reports that were presented at that forum need to be shared to improve quality of healthcare. That actually informed this meeting. Okay,
the basis of that meeting. So on the issue of the formation of the audit committee that you made reference to. Do you have a problem with the way the scheme is run, for which you are thinking that for a long time, since 2009, there've not been effective auditing?
No, there have been. All that we are saying is that health insurance should continue this process in order to be able to build quality improvement capacity at the various facilities.
Right.
And also this will ensure that there is sustainable quality improvement plan at the various health facilities.
Right.
We are talking about how to be able to provide quality care to the people.
Right.
And through this audit process, it will enable the facilities also to sit up and put their systems and structures in place.
And you also think that providing this quality health care will work if the government decided to take off the 2.5% VAT imposed on imported drugs and the 17.5% on locally manufactured drugs? How does this work? I mean, if they take off the taxes, how is the scheme going to function?
Yeah, previously, if you look at the VAT Act, there was nothing like VAT on drugs imported or manufactured in the country. As per a letter dated 8th of January this year, the Ministry of Finance have directed that all imported drugs attract 2.5%, and all locally manufactured drugs attract 17.5%. This is too high, and it makes the cost of drugs very, very, very expensive.
Okay, Ms. Ameka, to go further, you were saying something, because
to go further,
yeah.
Since the introduction of this VAT on drugs, since January 8th, there has not been any review of medicine tariffs by National Health Insurance Authority.
Okay.
So it means that the service providers are already running a loss.
Okay, so let me hold you. I still have Mr. Adonu, who is with the National Health Insurance Authority, still with us on the telephone. So it appears, Adam, that the Association of Health Providers is saying something. Is it something that you possibly want to say and you haven't said it, and they're saying it for you, that the cost of drugs are going high because of the VAT, the imposition of 2.5% VAT on imported drugs and 17.5% on locally manufactured drugs? Is it making your work difficult?
Well, that's an interesting one. I think the Health Insurance Service Providers Association of Ghana have a strong team, and if they want to say something, or if we want to say something, we have quite a strong team, and we want to say that we don't really need anybody per se to say that for us. So I'm sure they are speaking for themselves. They have association members who are providers who buy drugs before they dispense or before they dispense to our subscribers. So I think it's a genuine concern they are raising.
Okay.
But unfortunately, from where I sit or from where we sit, we are unable to do anything about this, because this is solely a Ministry of Health matter. We don't control tax matters. So I'm sure it's an issue they are raising. So the appropriate, government agencies will listen and see what can be done about it.
But Salam, if you say there's nothing you can do about it, is it to admit that indeed these taxes, 2.5% on imported drugs and 17.5% on locally manufactured drugs, are making the cost of drugs high for your operations?
Well, to say that it does not have any effect on the amount of claims we pay at the end of the month or at the end of a period will not be entirely true. It will certainly have an effect on what we do, because that is an increase, a 17.5% increase or a 2.5% increase. I mean, the claims will shoot up, obviously, by that margin. So, what is important is that as we speak, we are in the process of reviewing our tariffs. We do periodic review of tariffs. And these are some of the issues which have come from stakeholders and providers. And the review team is critically looking at these, and we are all seeing what can be done about the situation. So it's not as if it's something we've left as it were. It's something that we are constructively engaging on and ensuring that something really comes out of it.
So it means that very soon, when you have reviewed the prices of drugs, it's likely to go up?
Well, I wouldn't want to preempt what the committee is doing, but the trend has been that sometimes you have the prices of some drugs, falling, and the prices of other drugs, going up. But if you look generally at the trend of things, the market forces at play and the economic situation generally in the country, I mean, it's fair to say that we could see some marginal increase or some increase in the total amount of money we pay for medicines. And mind you, medicines, as we speak, constitute about 53% of our entire claims burden. So, we are working seriously with drug manufacturers and others to see how best we can reduce that. But, of course, medicine is a big part of what we do. And anything to reduce that burden will be welcome. So, yes, there's some work on that. And we hope to chalk some positive results when the committee concludes on its work.
Are you not worried that with an upward adjustment or an upward review comes the situation where many people are squeezed out and are unable to afford health care? Because if they, are facing challenges from the income front and are not able to renew their insurance schemes with the authority, and the authority is also facing challenges paying claims, we will be back to square one
Well, that's an interesting one. The NHIA, I mean, does its best to give financial protection to a lot of people who are unable to afford. And then how much is the premium? The premium is not as huge as people think. The premium is just 7.2 cedis. And the highest you can pay for premium is 48 Ghana cedis. But a lot of the people pay between 15 and then 20 cedis for a whole year for all conditions, covered under our benefit package.
Yeah, but we're talking about very low-income people who, for such amounts, it's a big deal.
Yes, I mean, that's what I'm saying, that the scheme has a way of protecting people who have been identified as indigent and cannot pay. So once you cannot pay, the scheme has a way of determining that and has a way of covering you. And let's look at the number of people who don't pay. We will have about close to 70% of people who do not pay premiums at all. You have people below the age of 18, and if you look at the demographics of Ghana, that constitutes a huge part of the population of the country.
But of course you should take responsibility for that. If you have a large chunk of the population you are unable to reach, then you possibly are not doing your work well.
No, that exactly is not the case, and that is exactly what we are doing. We are reaching the people and ensuring that we give them service. Last year alone, about over 1 million of such people were reached. And a lot of work still goes into it. It's not very easy just getting these things done. But what is important is the commitment. What is important is that we are on it and ensuring that more and more people are registered. So yes, the economic situation is hard, but we are doing our job as NHIA to ensure that we give financial protection against the cost of basic health care as the law stipulates.
Right. So finally, I like to refer you back to the issue of the capitation. In March this year, actually, Parliament requested an extension and review of the current pilot in Ashanti region. Can you brief us what the status of the capitation is? Has the National Health Insurance Authority resolved to roll over the capitation to the rest of the country, regardless of Parliament's call for a review?
Well, I mean, we cannot do anything, in total, should I say disapproval, or in total, we cannot do anything which would be a slap in the face of Parliament, because these are the representatives of the people. But a lot of the things Parliament, is called for are things we are already doing. Parliament called for a review of the NHIA capitation. The review was an ongoing process, while the pilot was running. We're reviewing it along the way. I'll give you an example. When the capitation in its raw form was taken to Ashanti, there were a number of things which were included in the capitation basket. But those things, a lot of those things have been reviewed. For example, capitation, covered medicines, or medicines were part of the items in the basket. As we speak now, medicines are not part. Medicines have been taken out. We have maternal care cases. Originally, they were part of the capitation basket. They have been taken out. And then specialist OPD cases were also part. They've now been taken out. So now capitation, as we see it, is just 22% of the entire thing to do. And if that is not a review, then I don't know what that is. That is certainly a review. Right. We talked about low per capita rate. We increased the per capita rate from where it was to a certain figure. The percentages were different depending on the ownership of the facility, whether it's a government facility, a child facility, or a private facility. And I don't have the percentages readily to give you. So a lot of things have gone on, and we have Parliament asked the program to be extended to other regions. And indeed, I know you've been following, but we, on the advice of the Ministry of Health, have started rolling out the program to 3 regions: Upper East, Upper West, and Volta. And as I speak, they are in the process of constituting their regional implementation committees and then district implementation committees. These are the very first steps of things you do. And as I speak, sensitization and education, which is a huge part of the process itself, it's ongoing. So
Salam, you seem to be doing quite a lot. I mean, from what you're saying, you're doing everything right, but the challenges still exist. Let me cross over again quickly and wrap it up with Anthony Ameka. Anthony, your group has key issues. Your group has very key issues with the capitation. You say that the capitation should be a primary care, and clients should be educated and encouraged to choose facilities close to their residents. And you're also saying that the National Health Insurance Authority and providers should agree on the capitation rate and benefit packages. But these are only window dressing of the issues which Salam just raised. They're doing all these already.
Yes, basically looking at the learning from the pilot in Ashanti region, we realized that there's more to be done before health insurance roll out capitation in the other 3 regions of the country. And we are saying that before they go out there to roll it out, they should engage the subscribers, they should engage the providers, they should engage even the National Health Insurance staff and educate them, the community.
But Salam on the other line is saying they're doing just that. So, I mean...
I don't know. Well, we are on the ground, and I'm telling you what is actually on the ground, and these are recommendations coming from the providers.
Right.
That they need to do education a lot, provide a lot of education to the, how do you call it, the stakeholders before they roll the capitation out.
Right. Thank you very much. I'm afraid our time is fast spent. And Anthony Ameka, this is where we'll bring our conversations to a close. We're very grateful that you could make time with us. Anthony Ameka is the Director of Communications and Operations with the Health Service Providers Association of Ghana. Salam Adonu is the Communications Manager with the National Health Insurance Authority. This has been today's big story. We'll be right back with an interactive segment. Stay with us. Welcome back to the interactive segment. Marian Turi, let me put you on the spot. Somebody asked me a very intelligent question today, and maybe I want to put it to you.
Please do.
Right? You're a book-long journalist.
Me?
It shows in your face.
You!
Hey? You went to London Met.
And you went to Cardiff.
Now, how do you decouple politics from development issues as a journalist when you are reporting them? That's for you.
To think about or to give you an answer now?
Well...
Food for thought?
Yeah.
Okay, food for thought.
Political issues. How do you decouple them from
sometimes,
developmental stories?
Sometimes the developmental stories are so in bed with politics that you can't decouple them.
Everything is politics, eh?
Everything is politics. That the man sitting out there to even get his money, his MP's common fund, it's...
you see?
Exactly.
I said it, you're book long. Right.
So that was fake.
What's training?
Line and sinker.
What's training?
I want to ask you about your HIV status, whether you know.
I do know.
You
my
do know.
status,
And
yeah.
you're clean.
I'm clean.
Wow, fantastic.
I'm sharp.
You're sharp. So that's what we're talking about today. Welcome to JN Interactive. My name is Marian Ture. So, welcome back. If I'm laughing so much, I'm not going to tell you what it's about. The people here are putting me on the spot. But I have checked my HIV status, and the last time I checked, I was actually clean. But I'm talking about it in a different context today, with churches actually asking for, couples to disclose their HIV status before they get married, whether you're for it or not. I do not know, but that is what we're talking about today. You can join us on social media with all your comments, and we would amplify them and share them with the rest of the world. Join news at on TV is where you'll find us on Facebook. Comment on all the posts we put there. We would amplify it and share it with the rest of the world. We are on Twitter too. We tweet at Joy News on TV. That is for the main Joy News Twitter handle, and if you're sending us a tweet to the show, it is JN Interactive GH, at JN Interactive GH. I am on Twitter too, and I tweet at MN Ture. Our email address is joynews@multitvworld.com, and our new WhatsApp number, and it is working like magic. You all send your WhatsApps there. Thank you so much. It is 05401090009. And JN Interactive is where tech meets news to set the agenda. Today we are talking about it. And the National HIV and AIDS STI policy has banned religious sects from asking for an HIV certificate before blessing a marriage. It also says employers have no right to deny any HIV positive patients a job on that ground. The policy was framed, it was framed under the health, safety and security, under that umbrella to make sure that we are all, safe. It also is saying that it does not side with any advertisement at all that says they have medicines or cures or anything like that for HIV/AIDS, because perhaps there isn't. And the Ghana AIDS Commission is also saying that it is very, very worried about that growing phenomenon where, my employer or your employer would say, we want to see your certificate before we even give you a job. And I want you to tell me what you really think about this one. Because, you see, there are two sides to the story. I can tell you my opinion, but I'd like to know yours also. For me, knowing my status is very, very important. And knowing the potential man that I'm going to marry status is also equally important. So if my church decides to impose this, as let's say during counseling, let's make sure the both of you are safe and so bring an HIV certificate, Marian Toure, I wouldn't have a problem with it, because I am thinking that if my church is actually concerned about my spiritual well-being, it's also concerned about my future health and my well-being, that perhaps the man that I'm marrying, I don't know his status, I go and marry him and it's disaster. That is my take on that. I don't know about you. In the Islam's, religion, does the imam ask you to bring your certificates before? Or what do you think about it? Would you think an employer would say that, hey, perhaps I am giving you health insurance so that when you're sick on the job, you can go to the hospital. But I need to know your HIV status before you end up costing me 3 arms and 5 legs, if there's anything like that, on my health bill. Would it be wrong for your employer to actually ask you to show all of these things? Food for thought. That is why you are there and I am here. And you send all your comments, whatever you say, I amplify it and I share it with the rest of the world. But on Joy News today, HIV/AIDS Administrator Reverend John Azuma explained that he, from his perspective, that no religious body has the right, and I'm quoting him, to ask any HIV certificate from prospective couples. That is his take on that. Let's take a listen to him in our first video blog.
It's a bit difficult. It's a bit difficult. If they know, probably unless they don't know, they will easily employ you. But what we are realizing is that if they know, they are denying people. One of the ambassadors was recruiting to the security system. He was denied based on his HIV, because his HIV. Today, look at her. She's very fit, strong, and can do everything. But what they realize is that they think they are not fit. They think they can't do the job.
How often do you get such reports from your group?
Oh, they often come. If you come to my office, I have a whole file that people come and report this, that I've been sacked because of my HIV status. And when they got to know, they have even, there was a case where even they demote you. Instead of pushing you, they demote you. A guy was demoted to the security. It was a biscuit factory, and where he was, after they got to know, they have to push him to security. So if today I'm HIV positive and I'm operating a restaurant, you can freely come and eat and go. That will not make you infected. If I cook for you, what is the basis that will infect you? Is HIV does not go through cooking.
Well, he was also very, very worried that organizations actually demean employees by asking them to, show that either they are HIV positive or not. Just take a listen to him.
I think it's a very good thing, because if you take it one by one, the first one being the religious leaders demanding certificates, this full stigma. Yeah, what we want the religious to do is, during your counseling process, encourage the couples that as part of the counseling you are supposed to know your HIV status, but we don't want to know. That's a simple thing. Let the couple decide. They should tell me your status. I should also tell you my status.
Is that not what the churches do?
No, they want a certificate. They want a proof. And when they know the proof, and if it is positive, they don't bless the marriage. And sometimes they even send people to the hospital that they should bring the result to them. You see, so if a marriage counseling setup is here, maybe 4 people, 5 people, you see, before you know, they know first. And what is the surety that they will not go and even tell others about my status? And why am I in see marriage is cancelled? And that rumor goes up, and people got to know that it's because they are HIV positive. And today in Ghana, we have seen people who are HIV positive but are married to negative ones. And the negative ones still remain negative. And they are producing negative children. That is the power of the antiretroviral. So this policy says that when you do your counseling, encourage them to marry, but let them do their HIV status, but don't demand the result. Let it be between the couples themselves. If I am positive and you still want to marry me, fine. If you are positive and I am negative, I still want to marry you, you should go ahead and marry. So fast as I am on antiretroviral, my chances of infecting you is very low. So this is the stand of the Ghana AIDS Commission.
I see.
I understand where he's coming from, but you see, when you have done this and the certificate is out there and you show it to your partner and say, okay, I am HIV positive, and then the partner decides, okay, I don't want to marry you, whether you tell the church or not, I'm sure that they'll be sniffing around thinking something has happened, that's why these couples are not getting married. But perhaps you should keep it between the two of you. I understand that. It is your prerogative to keep that to yourself. But indeed, it still would be nice for you guys to know, because I am sure, perhaps I should put this question to you and create a different post on social media to ask you that during counseling, if you find out that your potential wife or husband has HIV, with all the drugs that are available, injections, tablets, what have you, even if they say he can go and bath in the Nile to get a cure, would you still want to risk marrying them? It is a human thing. I personally, no matter how much I love you, I can tell you, if you come to me and you have a certificate and says HIV positive, I'll let you go, because I am scared. I don't know what I can do to contract that disease. So I'd like to know. But then, if for our own privacy's sake, the church does not have to know, fine, my hands are raised. I surrender to that. A lot of your comments have been dropping in. Some WhatsApps have been coming. Sarah has been out there to also ask you what you've been thinking. I'll take our WhatsApps first, and then we'll go and take what Sarah has brought in from you, from the outside. And so, the WhatsApp today, this one is coming from Frederick, who says churches shouldn't make it mandatory. HIV testing is to be suggested to couples. It is a good thing to know your status before marriage. Most people will not even know they are HIV positive till they die, really, because some of us are keeping ourselves safe for our family. Okay, it's a very good idea for some churches to go for an HIV AIDS test before marriage, but on the other side, they are now driving away really from marriages because nobody knows what will happen. Okay, then please keep chaste, keep yourself holy for the Lord if you don't know what will happen. And that one, there's no name there. The last one says, it is not fair at all. But what God has put together, no one can put asunder. Even it. What God has put together, no man can put asunder. Even it. Perhaps we should go like that, huh? Some comments have been dropping in on Facebook also. But let's go and take, our video blog. Sarah has been out there. She's caught up with you to hear what you have to say. Whether you think that demanding certificates from prospective couples that the churches are, bringing up is the way forward. Let's take our video blog.
Thank you, Marianne. The Ghana AIDS Commission is worried about the situation where some churches have been asking couples to present HIV/AIDS certificates before allowing them to get married.
It's good to find out whether the person you are going to marry have AIDS or not. Yeah, but it should be a personal issue. Yeah, this is not a duty of a pastor.
If they know about each other and they understand each other that, oh, this is my woman and I know she having HIV, or this is my man, I know she having HIV, and they understand each other that no matter what happens, we're going to be with each other. So once they understand with each other and they don't have the certificate and the church said they don't gonna marry them, I think for me that's unfair.
Christ didn't come for on graduates, but he came for her, he died for her. So for me, I don't understand that why people with HIV do not allow them to get married.
For churches to accept certificate before marriage right can be approved is something, certainly, is something which is important, very, very important, because it will help to reduce divorce in relationships and so many other forms. So my thought about it is it's necessary, it's really important.
If the two accept to be together, irrespective of whatever that they think is between them, then I think the churches wouldn't or shouldn't put any impediment on their way, or shouldn't be an impediment on their way to be together as couple. But on the other side, if that is the rule of the church that they both belong to, and if they believe in the church and they believe that is the right thing, why not? The churches have every right to ask for it.
If the two people can agree that, okay, regardless of our status in life, we can agree, to live together. Who is the pastor to say no? Even if he says no, they can even go ahead and get married. But then maybe it might not be in the same church, but they can go elsewhere with the registrar general to register, and it's also recognized as a marriage. So I don't think the pastors have any right to do so. It's a personal. It's between two people. So once they agree to live with their to live together, regardless of their the blood type, it's nothing.
Welcome back. We'll take some comments that have been dropping in on Facebook, and we have been asking if you think this practice is actually fair, and do you support it, and will you even have your status checked to satisfy this requirement? And you have been joining us with your comments. I'll take some of them that have been dropping in. Myra Abdul says, I think it would help you to know your status before marriage. That's what you were thinking. About it, Frank Hartman says, the insistence on HIV/AIDS tests before marriage by some churches infringes on the human rights of couples to keep the results of the test confidential, as pastors would have to be informed of the outcome. Nobody could be forced under the laws of the country to take HIV/AIDS test if they do not want to. Instead, the churches could counsel couples and give them the freedom to decide decide whether or not to take the HIV test ahead of their marital plans. The churches themselves make up the matter and discuss the human rights issues involved to enable them decide whether to scrap the practice or not. As a result of the high level of stigmatization and discrimination against people living with AIDS, there is a need to educate people to voluntarily undergo HIV/AIDS tests to know their status. This practice is bogus and capricious. I understand where you're coming from. Of course, like I was saying before, the issue of HIV/AIDS, the testing itself, and even the disclosure, it's a very sensitive issue. And so to actually think that your church will be imposing it on you, well, that I have a problem against. But for my own self, for you and your partner to decide that, hey, we want to find out, it is up to you. And so go and then have yourself tested, find out, because in the long term, I am sure that it will save you a lot, rather than going in blindly and saying, we don't really care. Later on, if you find out what happens, you would perhaps break a family if you have kids involved. You know, here in Africa, I think what we really need to do on AIDS and all of these diseases is to educate ourselves and get a heightened sense of awareness that getting AIDS is not the end of your life. There are people who live in the West who have HIV/AIDS and they're living normal lives and nothing has happened to them. But perhaps it's just our own perceptions, you know, as Africans and as Ghanaians that make it a very mysterious thing. And of course, anything without a cure would be mysterious to us. Even malaria should be mysterious. So it just shouldn't be HIV and AIDS. Move on to our next comment. Newton Jefford says, there's nothing wrong with it because marriage is a life affair. When the status of the couple are known, the pastors will be in a better position to counsel them so as to avoid problems in the marriage. Okay, Ejekum says it's rubbish. For you, total rubbish. Peter says, yes, I think it's a good idea to help you know your status. Seth says, yes, it is fair. And so the comments are quite divided, each to their own. Everybody is thinking something different, and that is what makes Gen Interactive very interesting. Whatever you put out there, we share it with the rest of the world because, hey, opinions like noses, we all have them, and we are entitled to them. Ebenezer says it's a very good idea. Kwesi Ghana. Jima says it's unfair. Benjamin, I agree. He says this is vehemently unfair. I'm sure you're adding vehemently to stress the unfairness that you think is coming out of this, because it will help protect the innocent from any hidden harm. Okay, and you're sending this in from Sunyani. Adongo says it's very necessary because it would help prevent dissatisfaction for one another afterwards. Okay, Husseini says, I think it's a good idea. It is even good for the will-be couples to know their status without the church asking them to do so. And that is where I was coming from, that for your own benefit, for yourself, demand more of your partner, your potential wife or husband. Abdul Razak is sending this in from Tamale. And you say, what about those who are Muslims? Because it is a good step in the right direction before marriage. However, how many people are ready for this good initiative? So it is your own personal initiative. It shouldn't just be imposed by the church or by your imam. And so let's go and take our last video blog. When we come back, we'll take some more comments and then we'll wrap up the show.
Also, do you think that this may lead to some sort of discrimination, and what can we do to control it?
Certainly, that will go a long way to affect some people somehow. But you can understand, yet you and I know that it will help us a lot along the line. You should forget about the indiscrimination, about whatever. It has to be so.
It's when the church asks people with HIV not to step in the church house. That's where, for me, I would take it to be discriminatory. But then, if they're asking people who are going to be together forever, and we know the effects of HIV/AIDS, and they think for that church they cannot bless such a union, I think they have the right. It's not discriminatory.
Who knows? Maybe I am HIV positive or you are HIV positive. Who knows? No one knows. It can even happen to the pastor himself. So suppose that he gets the HIV. Will people also isolate themselves from him? That's the question that they have to ask themselves. So, I mean, HIV is just a disease. But when it happens to you, that is not the end of your life. So I don't think, fine, there could be that kind of discrimination, but then regardless, let's face the fact, anybody else under this on this earth can be affected, regardless of who you are.
And yes, indeed, that gentleman was right. It can be any of us. So seek to protect yourself rather than follow any prescription from a church or any religious body if you think it infringes on your rights. I'll take some more comments. Steve will join us. We'll wrap up. Nana in Shraba Income. So when they are positive, what happens? Yes. You decide that they break up before they try joining holy matrimony. Then they've done sokolala. No, you're naughty. Forget the test, okay? Emmanuel says, I think there should be a practice among all churches. Prevention is better than cure. This one from Peter says, I think it's fair because it's unfair. It may lead to discrimination. Last but one comment before we wrap up. Abuga says it's necessary to do it so as to cut down the rate of divorce, because if it's not done and they get to know it after marriage, they will still break up, and that will create more problems. Well, I'll take two more. Daniel Pascal, good idea, but it should not be compulsory. Okay, it should be left to you. Abdul Rahman Fuseni, no, I don't think it's fair, because we live in a country where people are not ready to stop stigmatization of people living with HIV. And that is where we drop the curtain on today's show. Stephen A.T. is back. We can wrap up together. Welcome back.
Hey.
Sensitive topic.
So, very sensitive topics, but, well, I mean, you know, because of the job I did in the past, I had a lot of good friends who are HIV positive, and they have a fulfilling life. They have a fantastic life, and they look up to long life.
So HIV is not a death sentence?
No, not at all.
Nothing should be.
No, not at all. I mean, the worst thing we can do is to discriminate against people who need our love and attention. So, stories you should expect at News at 8. There seems to be no end to what has become known as the sadder story. Israel I refers to it as sadder than sad. After Tuesday's reports, which highlighted the desolation of supposed afforestation zones in the Savannah's related development authority, it turns out due process was not followed in the award of the 32.4 million Ghana cedis contract to ACI Construction Limited.
And also to expect in News at 8 with Israel, the PPP has blamed the numerous challenges confronting the education sector over the past 12 years on the various governments it says have poor organizational structures.
And so you should expect Johnny's exclusive immediately after this. I never fail to remind people that we have Johnny's exclusive coming up. My name is Stephen Enti. This is how we wrap Johnny's Interactive and today's big story.
And my name is Marian Toure. Enjoy the rest of our programs. Good evening.
Good evening.